Coalition Against Tobacco has commemorated the 28th edition of the World No Tobacco Day in Yaounde under the theme, the fight against the illegal trade of tobacco.
The coalition brought together the youth, policymakers and health workers to brainstorm on the socio-economic impact of illegal tobacco trade in Cameroon.
Quinta Rita Edan has details on that story.
According to statistics from WHO, 6 million people die every year across the globe as a result of tobacco consumption. In Cameroon, the situation is equally disturbing as 6 out of every 10 youth aged 15 and above consume tobacco, while 1 out of 2 smokers die from tobacco-related complications. This has been attributed to the illegal trade of the product as well as the very low cost, which renders any action against its consumption ineffective.
When the tobacco is sold on illicit basis, it's very cheap and everybody can smoke and get harmful effects of tobacco.
As members of the coalition, youth and decision makers commemorate the day, which comes up on May 31st, focus on a roundtable organized on the event was to step up prices as a means to scale down consumption and the need to put in place an anti-tobacco law. Different speakers hailed efforts by the coalition to roll back the consumption of tobacco, which has a huge economic impact, as a study carried out by GCAN indicates that 29% of cigarettes sold in Cameroon is contraband, which costs the state about 4 billion annually in customs revenue.
Still on No Smoking Day, the Divisional Officer of Bamenda 1 has prohibited smoking in public places.
Yaounde told CRTV on the occasion of World No Smoking Day that the measure is to protect the population of its subdivision. Winston Lebga reports from Bamenda.
Cigarette smoking reportedly kills thousands every year, and in Bamenda 1 subdivision, it is increasingly commonplace to see people smoking in public places. The subdivisional chief executive has issued a release prohibiting smoking in public.
This decision is a good one to protect the health of the population.
To these gentlemen, cigarette smoke kills only the unfortunate.
My grandfather smoked, I lived for 100 years. So if I smoke and live for 100 years, I'm not even sure I smoke.
Several inhabitants of Bamenda 1 appreciate the need for immediate action, but the nurse fears about the effective implementation of the prohibition.
How will the procedure be? Because in public places, sometimes you want to tell somebody, oh, stop smoking around me, and tell you he's enjoying his money. If you meet with those who are continuing to smoke in the public places, we will stop them.
Many bar owners see the prohibition as a laudable move to bring the public smoking problem to a wider audience.
Now that Joe have said no smoking in the public, when they come, I tell them, I have some bush behind my barbie. If you love smoking, go there and stand there. You smoke alone, you stay there.
Cigarette packets carry the warning that tobacco smoke is not only dangerous to the consumer, but even more to those around the smoker.
The combination of factors, if they were predisposed to high blood pressure, the vascular damage will make the high blood pressure cases worse, and if they were predisposed to diabetes, it makes their diabetes worse. So most of these things just get worse with the effect of the nicotine, the tar, and the other substances.
The divisional officer has a good number of items on his agenda. Apart from the prohibition of smoking in public places, there is also the burning issue of the cleanliness of Bamenda 1.
That's well, but it must begin from somewhere to stop smokers. The World Health Organization is this year blaming illegal tobacco trade for easing access to low-income earners, including children, to tobacco products and cigarettes.
WHO statistics say 44% of Cameroon's 4 million smoking population are the youth. Beatrice Ngum talked to some of them to find out why they smoke.
Inhaling smoke causes a choking sensation, but curiously, smokers somehow enjoy it despite the proven dangers of its contents. WHO studies have revealed that tobacco smoke contains 250 harmful chemicals, and nicotine stimulates feelings, which chemically alters the adolescent's brain once tested.
I don't really like smoking, but I smoke when I have too much work, especially mental work. After eating, I always want to take a stick.
At the beginning, I smoke pleasure. After pleasure, it became now, and I smoke now because my organism needs it. I smoke every time when I'm hungry, after eating, or when I'm angry, I smoke.
Public health advocates who have been scratching their heads over why teens know and accept that tobacco is bad, yet continue to smoke for decades now, say peers' influence is the biggest reason. Teens, on their part, say they smoke for the same reasons as adults, to cope with stress, control their weight as a social habit, and to combat boredom, although not ignorant of the damages of nicotine on health.
Smoking is dangerous. Yes, I don't like smoking, but I'm smoking. So finally, if I don't like smoking, I know that, oh, once in a while when I smoke and I feel a little bad around my chest, you will need a lot of products, medication.
Smoking rules that make it tougher for tobacco companies to target minors and not strengthened, sticks of cigarettes will continue to sell.